Hi guys, we're back again. I'm so sorry for the technical glitch, but we are back and I'm going to just quickly introduce everyone again so that we know what we're talking about. So this is Qura Talks, and we generally take up every month a health topic, and we talk about and discuss about your problems, and we debuzz the myths. And today we are going to talk about polycystic ovarian syndrome, because September is Polycystic Ovarian Syndrome Awareness Month, and Qura Diagnostics aims to bust all the myths about it. So I'm Dr. Soumya Dwivedi, the Chief Radiologist and Director of Qura Diagnostics and Research Center, Bhopal. And I have super specialized in women and pregnancy imaging. From the International Ovarian Tumor Analysis, I hold a certificate for women imaging, and that's my keen interest, to talk about women health issues and hygiene. And we follow this social initiative called as Inner She, in which we try to educate as many women and girls about their menstrual hygiene and health. So today we have with us two more expert panelists, Dr. Suvarna Vyas and Dr. Rohan Palsetkar. Let me quickly introduce both of them one by one. First, let me talk about Dr. Suvarna Vyas. She is a specialized nutritional management person who has all medical and surgical disorders covered. She has a commendable experience of more than 18 years. And she's treated more than 10,000 patients in her clinic Nutrinix, which are situated in Mumbai, Delhi, Chennai, Indore, Bhopal, as well as internationally, Singapore and UAE. She has specialized in PCOD with obesity and post-delivery management and weight management during pregnancy, even childhood obesity and growth and nutritional disorders. So we welcome Dr. Suvarna Vyas. I'm going to quickly let her in. And she is MS OBGY FRM and head of unit of Bloom IVF in DY Patil. She's the second joint, he's the second joint secretary in AMOGS and joint treasurer in MAGE. He's also the associate professor at DY Patil School of Medicine, and he has many awards in his bag, including Foxy Kurion, Shanti Yadav, Kumud Tamaskar, and late Praveen Mehta Award. He's also been awarded as MOG's Pramila Bhatia Young Scientist Awardee 2021 and as FOG Young Gynecologist Awardee, to name a few. And let me just invite Dr. Rohan also with us. Hi, Dr. Suvarna. Hi, Dr. Rohan.
Hello, Dr. Soumya. Hello, Dr. Rohan.
Finally, we have both of you on the screen together.
I'm facing a lot of actually Instagram issues. Yeah. Hello, Doc. Hello.
So welcome both of you to the health awareness talk from Qura Diagnostics. And I just introduced both of you, the expert panelists with us, and we're going to restart the session because, let's start from the beginning. Like I was telling the viewers, that we have got several DMs in regards to, bursting the myths about PCOS. And I should directly shoot the questions because I'm sure the audience is eager to get all their answers, right?
Yeah.
So my first question goes to Dr. Rohan. Dr. Rohan, let's start in a very simple way. If a person feels that they are suffering from PCOS, what are the signs and symptoms they can get alarmed from, that they should get a checkup, they should consult a gynecologist in regards to that?
Firstly, Soumya, thank you so much for having me. I think you're doing a fabulous job about bringing awareness about women's health issues. I've been going through your entire Instagram posts as well, and I've seen you've covered so many wonderful topics, and bringing about awareness about these things is the most wonderful thing. Now, getting back to PCOS, see, there's not one single criteria on which you can really decide your diagnosis of PCOS on. I think the most common myth which is there is that women sometimes who've just gone to get a regular pelvic ultrasound, they see polycystic ovaries on the sonography and they jump to a conclusion, oh my God, I have polycystic ovarian syndrome. That's not true.
Correct.
Generally, when we're looking at the diagnosis of PCOS, we're looking at three criteria. One would be your anovulatory cycles or irregular periods. Second, we would be looking at is if you're having any excessive hair growth, like around your face, around your
Right.
chin, around the upper lip, your sideburns, even your arms, legs,
Right.
etc. And the third would
Right.
be obviously the sonography, which shows a polycystic ovarian morphology. So now the main
Right.
thing is that you have to look at,
Right.
you need to suffer from 2 out of these 3 criteria. It can't be based on just one. So your
Correct.
sonography may be even completely
Right.
clear with no morphology being seen, but you could be suffering from
Right.
anovulatory cycle, that's irregular periods, plus excessive hair growth, which can also lead to a diagnosis of PCOS. In addition, it could
Right.
be any of the combination of the other 3, which I've talked about. So
Right.
based on just
Right.
one
Right.
diagnostic factor, you cannot say that you're a PCO. So what you should be looking at is tracking your periods, look for any excessive hair growth. And of course, if you've done a pelvic sonography, that's just going to help your doctor in
Add
getting you
on.
diagnosed.
Yes.
So yes, absolutely.
Right. So I'll just add on to this on sonography. When people come to us with irregular periods, that's the most common complaint,
Yeah.
when the periods turn up for a sonography of pelvis and they find a bulky ovary with a string of pearl appearance. That's like a classical finding of PCOS. So if you have that finding on your pelvic ultrasound, then definitely go back to your doctor and get the other tests as well to fit into this criteria which Dr. Rohan has mentioned, which are very, very important. So this is known as the Rotterdam criteria, and you have to fit into 2 of the 3. So thank you, Dr. Rohan. I think that's very informative. So don't jump to conclusions, follow the protocol. Right. So my next question is for Dr. Suvarna. Now the patient has
Yes.
been diagnosed with PCOS, right? And they want to know that what should they eat in a day if they have PCOS. Is there any particular diet we should follow, in a PCOS patient?
एक्चुअली पीसीओएस को लेके एक बहुत डिफिकल्ट कंसेप्ट लोगों के बीच में है कि यदि हम ओवरवेट है तो हमको पीसीओडी हो सकता है. मैं अपनी रेगुलर ओपीडीज में पेशेंट को देखती हूँ कि यदि पेशेंट अंडरवेट है, इवन वो नॉर्मल वेट में है या ओवरवेट है, ये तीनों कैटेगरीज में पेशेंट को पीसीओएस हो सकता है. तो यदि पेशेंट अंडरवेट है तो नेचुरली वो माल नरिशमेंट का पेशेंट होगा, बहुत सारी न्यूट्रिएंट डिफिशियंसीज होंगी, हीमोग्लोबिन लो होगा, आयरन लेवल बहुत लो होगा, स्ट्रेस इश्यूज बहुत होंगे. यदि पेशेंट को बहुत हाई स्ट्रेस इश्यूज है तो नेचुरली कॉर्टिसोल का सीक्रेशन बढ़ता है, एंड इट इज आल्सो मेन कॉज फॉर पीसीओएस. सेकेंड, जो नॉर्मल पेशेंट होते हैं, आइडियल बॉडी वेट पे हैं, उनका बीएमआई 24 है, उनकी हाइट के अकॉर्डिंग उनका वेट नॉर्मल है, पर उनकी जो लाइफ स्टाइल है वो नॉर्मल नहीं है. लाइक उनकी स्लीपिंग आवर्स 4 to 5 आवर्स है, इवन उससे भी कम है. उनका जो फूड कंजप्शन है वो बहुत वैसा है कि जंक फूड का कंजप्शन ज्यादा है, वेरी लो प्रोटीन डाइट. ओवरवेट की बात करें तो ओवरवेट तो नेचुरली यदि आप अपने आइडियल बॉडी वेट से 5 kgs भी एक्सेस होते हैं तो पीसीओडी डेवलप होता है. मैं अपने पेशेंट्स में बहुत कॉमनली एग्जांपल देती हूँ कि आप इमेजिन करें, लाइक हमारे डेक्सा स्कैन के अकॉर्डिंग आपका वेट 10 kgs ज्यादा है. अब हम आपको आइडियल बॉडी वेट पे ले आए और 10 kg का एक्सेसिव बैग आपकी पीठ पे लगा दें और फिर कहें आप इसको लेके मूव करें, तो आप मिनिमम 30 मिनट से भी ज्यादा मूव नहीं कर पाएंगे. तो जो एक्सेसिव वेट होता है वो तो पीसीओडी का बहुत मेन कॉज होता है, बट नेचुरली जो वेट गेनिंग होता है वो दूसरे भी कोमॉर्बिडिटीज जो होती हैं वो डेवलप करता है. तो हम तीनों कैटेगरीज में, जैसा कि अभी डॉक्टर रोहन ने कहा कि इसको हम डायग्नोसिस करने के बाद ही ट्रीट कर सकते हैं, और उसका सबसे ऑथेंटिक वे यही होता है कि हम 10th या 14th डे पहले एक सोनोग्राफी कराएं और उसके बाद सिम्टोमेटिक वे के अकॉर्डिंग उसको ट्रीट करें. बट हाँ, यदि पेशेंट 20 kgs भी ज्यादा है और वो अपना 5 kgs भी रिड्यूस कर लेता है तो पीसीओडी काफी कंट्रोल होने लगता है.
I think
So
Dr.
is there any
Suvarna,
particular... Yes,
yeah,
please go ahead.
I was saying that I think Dr. Suvarna made a very wonderful point that it's not only obese patients, मतलब सिर्फ ज्यादा वजन वाले patients नहीं है. We're looking at regular weight as well as lean patients as well who are suffering from PCOD. तो उसके वजह से we have to cover these small issues about weight loss. No, it's not just about weight loss, but when you're talking about normal body PCO and lean PCOS, we are considering lifestyle modification, which madam has said very well. And this myth needs to be taken out of the head of a patient that, oh, only if I'm obese, I'm going to have PCOS. It's not the other way around.
Exactly.
Correct,
जी
correct. So
exactly.
this is a very, very important point, and I was coming to this in the next segment that uh, generally it's a myth that all the PCOS patients are obese, which is
Obviously,
not
exactly.
true. Now we know that now. Also, thin patients, especially when we see our day-to-day OPD, I see many young girls who are very lean and thin, and they are having PCOS these days. That kind of clinical picture is more evident. What is your comment on it, Dr. Rohan?
So when I do look at lean PCOS is now developing, but I still
Hmm.
think it's in a minority as compared to
Okay.
the obese PCOS.
Okay.
But yes, I have now come across a lot of patients. Being an infertility specialist myself, I see a lot
Right.
of young patients who are trying to conceive and they don't have any signs of obesity. But as Suvarna ma'am said, that
Hmm.
these patients have very bad lifestyle because I see them in very type A personality patients,
Hmm.
especially those
Hmm.
who are working long hours. They're
Hmm.
getting barely 3 to 4 hours of sleep. Their eating patterns are very skewed. That
Right.
सुबह में breakfast करेंगे, their
Hmm.
lunch will be at 4, 5 in the evening, and dinner will
Hmm.
be at 1, 2 in the night.
Right.
So even though they're not maybe obese, but their
Hmm.
lifestyle is very unhealthy. So this
Hmm.
change of lifestyle, where they are being able to regularize their sleep, their food habits, is going to make such a difference. Because
Right.
main thing problem with lean PCOS and is that their
Hmm.
eggs are not forming and they're not ovulating. So for them,
Hmm.
even if I put them on
Right.
pills and everything, my medications are only going to
Hmm.
work on a certain percentage of patients. But if they
Correct.
don't make those lifestyle modification changes, as Suvarna ma'am was saying previously, that change,
Hmm.
improve your sleep habits, improve your food habits. I know I'm repeating
Hmm.
this again, but it's such an important point that she's brought up, because
Yes.
when these things happen, your body's hormonal
Correct.
cycle start regularizing. The pills which your doctor has given you plus your own
Hmm.
effort of regularizing your habits is going to make such a big difference in helping you ovulate, regularizing your periods, as well as helping you conceive as well.
So the consensus of this will be lifestyle modification is one of the most important factors to regularize PCOS, right?
Absolutely.
Correct. So, Dr. Suvarna, next question is to you. That a patient usually suffering from PCOS, this was asked to me, is really lethargic at times, and don't feel that their energy levels are up. Is there any specific diet or nutrient which you think is useful for such patients to increase the energy levels?
एक्चुअली जो पीसीओडी होता है, ऐसे
जी.
पेशेंट्स को प्री मेंसेस सिंड्रोम पीएमएस बहुत ज्यादा एक्सेसिव
Okay.
होता है, मूड स्विंग्स
Okay.
होना, एंजाइटी, इन सब का मेन कॉज होता है हार्मोनल इम्बैलेंस. जैसे अभी
Correct.
डॉक्टर रोहन बता रहे थे कि हम पिल्स भी देते हैं, तब भी पेशेंट की लाइफ स्टाइल बहुत हेल्दी नहीं है, तो नेचुरली हमको पीसीओडी उतना कंट्रोल या डिजॉल्व नहीं मिलता है. एक्चुअली जो
Correct.
पिल्स होती हैं वो भी एक बहुत बड़ा कॉज होती है वाटर रिटेंशन का. तो
जी.
नेचुरली ये उसके साथ पेशेंट की लाइफ स्टाइल बहुत अच्छी होगी. स्पेशली
हम्म.
हम न्यूट्रिएंट्स की बात करें तो
जी.
अकॉर्डिंग टू न्यू मेडिकल गाइडलाइन अभी हम बहुत ज्यादा विटामिन बी 6 यूज करते हैं,
ओके.
पायरिडॉक्सिन. ये
ओके.
पेशेंट की जो मूड इरिटेबिलिटी होती है उसको काफी कंट्रोल करता है. सेकेंड
ओके.
कंटेंट होता है जिंक. जिंक जो
ओके.
होता है वो भी नेचुरली मूड इरिटेबिलिटी, एंजाइटी, इनको काफी कंट्रोल करता है. एंड
हम्म.
थर्ड होता है आइनोसिटॉल. आइनोसिटॉल स्पेशली ओवरी का विटामिन माना जाता है, और अभी
हम्म.
आइनोसिटॉल के रिजल्ट्स भी बहुत अच्छे रहे. ये भी अपने आप में एक बहुत अच्छा विटामिन होता है. यदि हम
ओके.
डाइट की बात करें तो
हम्म.
एक्चुअली जो भी पीसीओडी पेशेंट होते हैं इनमें इंसुलिन रेसिस्टेंस बहुत कॉमन सिम्टम होता है. आप
ओके.
देखेंगे तो नेक एरियाज पे ब्लैक ब्लैक लाइंस होती हैं,
जी.
जिसको लेकर
जी.
पेशेंट बहुत कंफ्यूज होता है कि शायद हमारा कलर डार्क हो रहा है या हम अच्छे
हम्म.
से नहा नहीं रहे हैं. इट इज अ वेरी कॉमन थिंग,
यस.
बट वो सिम्टोमैटिक है कि उन लाइंस के थ्रू हम ये डायग्नोज कर पाते हैं विद द इन्वेस्टिगेशन ऑल्सो कि इंसुलिन
हम्म.
रेसिस्टेंस है. अब
हम्म.
इसको देखा जाए तो बेसिकली यहाँ पर क्योंकि हम एक सोशल प्लेटफॉर्म पे बात कर रहे हैं, और मैं हमेशा सबसे कहती हूँ कि एक पर्टिकुलर डाइट ऐसी नहीं होती है कि हर एक इंसान उसको फॉलो करे.
करेक्ट.
इंडिविजुअल बॉडी के अकॉर्डिंग नीड होती है कि आपके हाइट, वेट, बीएमआई, बीएमआर के अकॉर्डिंग क्या नीडेड है. पर अब एक
राइट.
नॉर्मल कॉन्सेप्ट की बात करें तो लो कार्ब्स दिया जाता है बिकॉज ऑफ इंसुलिन रेसिस्टेंस. जो प्रोटीन होता है वो डिपेंड करता है, यदि पेशेंट अंडरवेट है विद पीसीओएस तो नेचुरली उसको 1 to 1.5 ग्राम प्रोटीन पर केजी बॉडी वेट दिया जाता है। यदि पेशेंट ओवरवेट है और इसकी फिजिकल एक्टिविटी बहुत कम है, वो बहुत लिथार्जिक फील कर रहा है, एंजाइटी लेवल बहुत हाई है, तो हम उसे फर्स्ट डे ही कहेंगे कि आप जिम जाइए या वॉक करिए 2 hours, तो इट इज अ प्योरली इम्पॉसिबल थिंग, क्योंकि वो इतना एग्जॉस्ट फील करते हैं और बहुत हॉट फ्लशेस, बहुत सारे इश्यूज होते हैं। तो स्लोली उनको वर्कआउट के लिए काउंसिल किया जाता है, उनको बताया जाता है, तो उसके अकॉर्डिंग जो प्रोटीन नीड होती है वो चेंज होती है। ओवरवेट है तो 0.5 ग्राम पर केजी बॉडी वेट फिर 1 ग्राम पे शिफ्ट करते हैं, बट अब मॉडरेट से हाई प्रोटीन दिया जाता है, लो कार्ब्स दिया जाता है, एंड जो फैट होता है वो टोटली रिस्ट्रिक्टेड नहीं किया जाता है। कई बहुत अच्छे फैट्स वेजिटेबल्स में अवेलेबल होते हैं, जैसे एवोकाडो है, बहुत अच्छे नट्स में जो अवेलेबल होते हैं, तो लो क्वांटिटी ऑफ फैट भी उनको सजेस्ट किया जाता है। यदि हम सप्लीमेंट्स की बात करें, स्पेशली डाइट में ऐसी क्या चीजें हैं जो पीसीओडी में बहुत अच्छी होती हैं, तो नट्स अपने आप में बहुत अच्छा है। लो कैल जो चिकन्स होते हैं, खासकर रोस्टेड हम ले सकते हैं, फिश ले सकते हैं, ऐसे कई सप्लीमेंट्स हैं जो उनको दिए जा सकते हैं पेशेंट को। तो स्पेशली न्यूट्रिएंट्स में एक नॉर्मल कंसेप्ट की बात करें तो लो कार्ब्स, हाई प्रोटीन एंड लो फैट ओनली।
ओके, थैंक यू सो मच। आई थिंक दैट्स रियली यूजफुल। हाउएवर, मैम ने क्लियरली हमको बताया कि पीसीओएस रियली डिपेंड्स फ्रॉम वन बीएमआई टू बीएमआई। इट इज नॉट अ फिक्स्ड डाइट विच एवरीवन कैन फॉलो यूनिवर्सली। तो इसलिए यू शुड कंसल्ट एन एक्सपर्ट and then take a diet accordingly, and definitely in PCOS diet का एक बहुत major role होता है, जो मैम हमको समझाने की कोशिश करिए। We've just received a question which I'm going to just quickly take by Ashish Raj. He says, what is the role of a radiologist in PCOS? Like Dr. Rohan said that Rotterdam criteria includes 3 criteria, and one of that is a sonography of your pelvis, that means your ovaries. And in that, radiologist detect करता है कि patient को PCOS है कि नहीं on sonography. And that criteria is of 2 things that suggests on a transvaginal scan, either if you have one single ovary also of a size of more than 10 ml, or if you have more than 12 follicles in one ovary, then you are suggested to have PCOS. And then further clinical evaluation is mandatory to confirm if you have PCOS or not. So on sonography, हम label करते हैं polycystic ovaries. We never label it as a polycystic ovarian syndrome, because syndrome is obviously combination of multi factors, not just one. So on sonography, आप polycystic ovaries है कि नहीं, ये diagnose कर सकते हैं. So thank you for asking that question. Now my next question goes to Dr. Rohan. Rohan, please tell us that, you know, if a patient is suffering from PCOS, since you're an infertility expert, I want you to answer, can they get pregnant? Because that's a very, very common scenario we see these days.
Yeah,
can they
absolutely.
get pregnant if they are suffering from PCOS?
Of course, I think it's a major myth that... I'm sorry, can you all hear me clearly?
Yes.
Yeah, so I think it's a major myth that it's said that all PCOS patients can't conceive naturally. I think a lot of PCOS patients can conceive naturally. It's only that sometimes when you're having anovulatory cycles, basically when the egg is not growing and you tend to not have your periods for 4 months, 5 months, and even for maybe say 2 months or 3 months, the thing is that the oocyte isn't mature enough to fertilize. So in those situations is where we come in, that is Dr. Suvarna as well as myself. Because when I am there, I am looking at the patient, I look at what the lifestyle of the patient is. So majority of my patients who come to me who are PCO and want to try and conceive naturally, for me, my first priority is first take a detailed history to note down what is their lifestyle, whether they're getting in, as Dr. Suvarna said before also, I'm looking at their sleep patterns, their dietary habits. Do they have any addictions? There's smoking, there's drinking, which can also lead to other factors which can affect fertility as well. Yeah, so when I'm looking at all of these, my first 3 months when I'm speaking to a patient is that, look, if you want to conceive naturally, when you are a PCO, we have to consider this a long-term goal. It's not something that you're going to get immediately. So we look at least the first 3 months of the treatment protocol to be a part of lifestyle modification, along with some medications which are going to
Right.
help her ovulate as well as help her with some weight loss as well. As madam said, insulin resistance is a very common thing in PCO patients. So we
Right.
generally use a combination of drugs such as metformin, ma'am said ionositols, which I am a big fan of because it's not only it's an insulin sensitizer, which also improves the response of the ovarian follicles to all the medications that we
Right.
give to help the patients ovulate. So we do these
Right.
things before we actually consider going for any higher treatment such as an IUI or maybe an IVF. But understand one thing, when you're a PCO
Right.
patient, we have to look at the age factor, which is very important. So if you come as a PCO patient to me at the age
Correct.
of say 20 to 28 or 20 to 30, at that point, I'm going to be more inclined towards helping you modify your lifestyle and try and help you conceive naturally. When you're between the age of 30 to
Yeah.
35, my trial for a natural conception is going to be a lot shorter because I have to try and reduce the time to pregnancy. And if you're above the age of 35, we
Correct.
have to go towards a more accelerated approach towards a pregnancy. So it all depends on your
Correct.
age factor as well. It's not just about being PCO or not. So it all depends on the age as well as
Right.
PCO. So a lot of patients who do have PCO and come to me, my first deciding factor for my treatment is age. Then comes all of these things to decide whether they're
Right.
going to try to conceive naturally or through any assisted reproductive techniques.
Correct, correct, correct.
Yeah.
I think this is a very, very important point which Dr. Rohan has made. Age is a very, very important factor when patients are planning for a pregnancy, suffering from PCOS. So, Dr. Rohan, since we are talking about this, can you also tell us that do we need to get this PCOS cured first or they can conceive while having PCOS? That's also a very
Okay,
common question.
this is something which I actually like to talk about, that you can't really cure per se PCOS, but you can bring it under
Okay,
control. Okay, it's
okay,
something that you need
okay.
to understand that one, a lot of patients when they come, they want to one regularize their period and conceive. There's a certain line of treatment. So one is if you're trying to regularize the period, we generally put you on oral contraceptive pills. That
Right,
actually helps your hormones balance and you get your periods regularly. But it's completely against if you're trying to get pregnant. You can't use oral contraceptive pills. So what we do is we start them on
right.
ovulation induction drugs. And that also what it does
Hmm.
is because you're
Hmm.
ovulating, your egg which ruptures is going to release hormones which are going to regularize your period as well. So it's not, while you're on fertility treatment, you
Correct.
will get your periods regularly if you're continuing your treatment. At the same time, I would take Dr.
Hmm.
Suvarna ma'am's help in helping them get on a regular diet, get on regular exercise. I think what ma'am
Right.
said was a brilliant point, that you can't expect someone to start running 2 hours a day when they barely exercise for 5 minutes a day. Maybe some of them are not even
Correct.
doing any exercise. So I think it's very
Right.
important that when you're talking to a patient, it's important to
Hmm.
understand what is their interest or choice. Like for me personally, Soumya, I still remember that we used to enjoy playing sports back in college. So we would, for us, that
Right.
would be our
Right.
form of exercise. It's not necessary that we go to the
Right.
gym and work out. But obviously, when I'm trying to get a
Correct.
patient pregnant, I'm going to ask them that at least try and walk for maybe half an hour a day. Start putting
Hmm.
that in.
Hmm.
One thing I keep telling my patients is, do you watch Netflix, Amazon Prime, or anything? Sit and watch it. Walk in front of the TV and keep watching your program. So at least you end up pulling in at least a 30-minute exercise while watching your episode, and it helps. So I think
That's a great tip,
that
I
will
feel, Dr.
help
Rohan.
you with this PCO thing as well.
So,
I
coming to
think
that,
during
Dr.
this pandemic,
Suvarna,
it's the best
usually,
thing.
yes, I think it's the best
True.
thing because everyone's, glued to ODDs these days, and pushing in a workout with that is fabulous idea. All right. So, Dr. Suvarna, it's like we just discussed that, if a patient is trying to conceive naturally and, is around 30 years of age, an average age, and is it recommended that, or both of you can just comment on this, that is it recommended that 5 to 6 kg weight loss and, putting them on OCPs and withdrawing them can help them conceive in a faster way? both of the things together? One by one.
Yeah, as
Dr.
a
Suvarna, your take.
nutritionist, I am तो highly actually patient को मैं हमेशा suggest करती हूँ कि 5 to 7 kg weight, it is very effective for conception. Even जब वो टैबलेट से या पिल से हटते हैं उसके बाद भी naturally थोड़ा water retention होता है और कुछ weight यदि वो reduce करते हैं तो it is highly actually effective for कंसेप्शन. वैसे डॉक्टर रोहन ने भी देखा होगा कि कई बार ऐसा होता है कि पेशेंट यदि वेट रिड्यूस नहीं कर रहे हैं और वो काफी हाई वेटेड हैं, हाई बीएमआई पे है, तब भी पेशेंट कंसीव करते हैं. बट आई थिंक परसेंटेज बहुत कम है. पर ऐसा पेशेंट है, इवन माल नरिश्ड और अंडरवेट पेशेंट भी यदि पीसीओडी है और वो थोड़ा सा वेट गेन करते हैं तो उनके लिए कंसेप्शन बहुत इजी हो जाता है. बिकॉज वेट जो रिड्यूस्ड पेशेंट होते हैं, जो काफी लोअर वेट पे होते हैं, उनको न्यूट्रिएंट डिफिशियंसीज बहुत ज्यादा होती हैं. तो नेचुरली जो हेल्दी एग वो होना चाहिए वो नहीं मिलता है पेशेंट में, और न्यूट्रिएंट डिफिशियंसी की वजह से काफी सारी एंजाइटी इश्यूज होते हैं, पॉजिटिविटी उनकी काफी लोअर साइड होती है. तो न्यूट्रिशन, वेट रिडक्शन, ये दोनों मेजर रोल तो प्ले करते हैं. बट मैं पूरा रिस्पॉन्सिबल नहीं वो कहूंगी कि नहीं, इन दोनों का बहुत मेजर रोल होता है. हायर वेट पे भी पेशेंट कई बार कंसीव कर लेते हैं.
No, I
Dr.
think
Rohan, your take.
Dr. Rohan, आप बताइए.
I think what Dr. Suvarna ma'am has said is really useful. Just a 5% body weight loss, 5 to 10% body weight loss is going to help you ovulate better, get your hormones back. PCO is a very vicious cycle, PCOS.
Exactly.
The thing is, your weight, PCOS makes your weight increase. Since your weight increases, the PCOS worsens. Because the PCOS is worsening, your weight is going to gain more, and this cycle just keeps on going and going. So you need Dr. Suvarna somewhere to break that cycle. It's not possible without that.
Right.
Yes, as Dr. Suvarna said, that we do have a lot of obese patients who do get pregnant with PCO. But if they do a little bit of weight loss, it makes the job easier for them as well as for me. Because then conceiving naturally gets better. I don't have to apply ART techniques. I'm just one thing with regarding now the new generation OC pills which are there, the chances of water retention are minimum because the estradiol levels are very low and the progesterone levels are very low. What I don't like to do, especially with patients who are trying to conceive, is to put them on oral contraceptive pills. I'd rather use progesterone I'd rather use progesterone tablets to get their periods, and then after that start them on ovulation induction drugs to help them regularize their period, because what I'm trying to aim at is trying to grow their eggs. So sometimes what can happen is it can get delayed the periods. I've had one patient who ovulated on day 30 of her period but got pregnant. So it's sometimes in these PCO patients, they're resistant. Like day 30 is when you're actually expecting your periods. But she ovulated on day 30. And day 42, she had a positive pregnancy test. So in those situations, it's completely understandable that you can have patients who are resistant to their eggs growing. So sometimes it takes a lot of effort. But one thing you have to realize is be patient. Don't give up, because it is a syndrome, as you said. It's not something that's going to go at the snap of your finger. It's something that's going to require a multidisciplinary approach. It's going to take me the radiologist to help me. It's going to take the nutritionist to help me. It's going to be me. All three of us have to actually sit together. As I think Ashish had said, that what is the role of a radiologist? For me, when I am actually doing ovulation induction, I'm also asking the radiologist, please look at the stromal thickness, look at the stromal volume, because that's actually going to let me know how resistant the ovary is. So I think, Soumya, you're a very important tool in PCOS and infertility. I think it's not possible for me to go without having the entire team there. So as Suvarna ma'am also said, that water retention you may see in some patients, but that goes away as soon as the periods come. Because what's happening is there is a lot of water retention because of the lack of progesterone, and when you get that withdrawal of progesterone, you're getting the menses out as well as whatever little bit of water retention. But understand, water retention is barely going to be 1 or 2% of your
Yes.
total body weight. It's not going to be a
Correct.
majority of your body weight. So don't expect if you are, say for example, 60 kgs, you're going to lose 3 kgs by getting your periods. You're maybe going to lose maybe 300 to 400 grams. So
Right.
please
Correct.
understand that
Correct.
just the
Correct.
water retention is not going to help you with your weight loss. What Swarna ma'am said is your exercise and your diet is what is going to change your treatment protocol and going to help you conceive. But yes, PCO patients who are obese can conceive, but understand the success rates are a little lower because it takes more treatment protocols and you may require higher treatment protocols such as IUI and IVF to help conceive.
Correct. Okay. Dr. Rohan, since you just mentioned in regards to OCPs, and we just discussed about, water retention, there is a very common myth in regards to this also in young girls suffering from PCOS, that my doctor has put me on OCPs, now I've gained so much weight because of that.
Oh,
What is your comment on it?
I'll tell you what.
Both of you must be facing this. I think I want you to answer.
When I look at young patients, I am looking, no doctor's going to start a patient on OC pills unless she's above the age of 16. So when I'm looking at young patients who are on OC pills, I'm looking at an age group of say around 16 to 24. Those are your college days. Look at the kind of lifestyle you're actually leading during those college days. Let's look at our own college days. Forget about anybody else's. We would go, we would eat at the easiest dhaba, you'd eat fast food, you're eating junk. You're not really bothered about your diet protocol per se during that time. Yes, you're taking OC pills that you may think that you're gaining weight because of the OC pills, the other lifestyle changes that have been happening in your life. So the OC pills, even if there is water retention, it's going to disappear the minute you get your periods. And now with the kind of OC pills that are available in the market, you have such low dose OC pills, they don't really cause any water retention. You have to look at your lifestyle modification as well. In fact, I have a current patient who came to me and told me that, Doc, I'm gaining weight because of the OC pills. Her breakfast used to be a 700 calorie breakfast. Snacks used to be 400 calories. Lunch used to be about 650 calories. And dinner used to be about 800 calories. I'm like, your intake is about 2,500 calories per day. Your exercise output is barely half an hour of walking. And how can you say that the OC pills are the thing that causing? I think, Suvarna ma'am, you should be able to give a little bit more on this.
Yes, ma'am, please.
देखिए डॉक्टर, जितने भी मैंने अभी पीसीओएस के पेशेंट देखे हैं डॉक्टर रोहन, एक्चुअली मेन कॉज जो होता है वो एक लेथार्जिक फीलिंग होती है बिकॉज ऑफ हार्मोनल इम्बैलेंस, और नेचुरली वो यदि वेट गेनिंग के साथ आ रहे हैं तो बहुत बड़ा कॉज होता है उनकी लाइफ स्टाइल, एक्सेसिव कैलोरी कंजप्शन. कई पेशेंट्स में मैंने देखा है कि वो बहुत अच्छा जो फूड होता है, जो न्यूट्रिशन वाला फूड होता है, वो ना कंज्यूम. सो सॉरी डॉक्टर सौम्या, आई थिंक I'm facing some issues.
No problem. We can hear you.
जी. जंक फूड का कंजप्शन, हम 3 कैटेगरीज में पेशेंट को डिवाइड करते हैं. एक होता है 16 to 25 ईयर, ये लोग बहुत ज्यादा जंक फूड का कंजप्शन करते हैं. यदि वो ट्वाइस अ वीक भी पिज्जा, बर्गर ऐसी चीजें कंज्यूम कर रहे हैं, तो एक बहुत अच्छा कंसेप्ट होता है कि आप अर्न कर रहे हैं तो बर्न करिए. वो सिर्फ अर्न करते हैं, बर्न वाला का वो जैसे मैंने कल ही एक पेशेंट और 104 केजी की थी, बहुत यंग एज की गर्ल थी, 16 ईयर की. कंजप्शन वही था फूड का, बट पूरे दिन की यदि एक्टिविटी देखें तो देयर इज ओनली 700 स्टेप्स इन अ वॉक इन अ डे. तो ये एक बहुत बड़ा कॉज होता है. और ओवरवेट के साथ जब वो पीसीओडी के साथ आते हैं तो बिकॉज ऑफ इंसुलिन रेसिस्टेंस, बिकॉज ऑफ एक्सेसिव कॉर्टिसोल का सीक्रेशन, एंड्रोजन हार्मोन का सीक्रेशन, उसकी वजह से एक डलनेस, एक कम फिजिकल एक्टिविटी वाली जो उनकी एक्चुअली टफ टास्क. जब भी मेरे पास पेशेंट आते हैं तो मैं हमेशा उनसे एक चीज कहती हूँ, आई एम नॉट अ मैजिशियन. इफ यू हैव 4D, डेडिकेशन, डिवोशन, डिटर्मिनेशन एंड डिसिप्लिन, देन आई विल गिव यू रिजल्ट. और आप नेचुरली तभी वेट रिड्यूस कर पाएंगे. आपको जो भी डिफिशियंसी है लाइफ स्टाइल डिजीज से रिलेटेड, वो सब आप डिसॉल्व कर पाएंगे. तो बहुत टाइम लगता है मोटिवेट करने में, बट हाँ मैंने हमेशा पेशेंट में देखा है जब वो 6 to 7 kg रिड्यूस कर लेते हैं और जो एक्सेसिव वेट उनका चला जाता है, फिर धीरे धीरे वो मोटिवेट होते हैं फॉर फिजिकल एक्टिविटी, वो फिर स्लोली जिम ज्वाइन करते हैं, अपना वॉक रेगुलर करते हैं, और जैसे ही उनका डाइट कंजप्शन, डॉक्टर रोहन आई थिंक आपको बहुत अच्छे से मालूम होगा कि ग्रालिन और लैप्टिन ये दो हार्मोन होते हैं जो बहुत ज्यादा रिस्पॉन्सिबल होते हैं फॉर वेट गेनिंग के लिए। हमने कई पीसीओडी के पेशेंट्स को देखा है जिनको याद भी नहीं होता है कि उन्होंने रात में नींद में उठ के पूरा एक डेयरी मिल्क खा लिया। मॉर्निंग में उनको जब रैपर निकलते हैं उनके पिलोज के नीचे से, तब उनसे पूछा जाता है, फैमिली मेंबर्स या मदर पूछती हैं, तब उनको बहुत ज्यादा याद भी नहीं होता कि उन्होंने ये कंजप्शन किया है लेट नाइट। तो इंसुलिन रेसिस्टेंस और ग्रेलिन लैप्टिन का एक्सेसिव सीक्रेशन बहुत बड़ा कॉज होता है। तो डेफिनेटली जब डाइट स्टार्ट करते हैं पेशेंट, 3 to 4 days लगता है उनको रेगुलराइज करने में, इस चीज को बहुत स्ट्रिक्टली फॉलो करने में। आफ्टर 5 days जब उनको 2 to 3 kg का रिडक्शन मिलता है तो वो बहुत आराम से करते हैं। और डॉक्टर रोहन आई थिंक आप मुझे बहुत ज्यादा अप्रिशिएट कर रहे हैं, बट इट इज अ वेरी ऑथेंटिक वे कि वेट रिडक्शन के साथ पीसीओडी जो होता है वो डिसॉल्व होता है। मैंने देखा था डॉक्टर रोहन ने भी एक पॉइंट बोला था, और ये पेशेंट्स मुझसे भी पूछते हैं कि डॉक्टर ये टोटली ठीक हो जाएगा क्या पीसीओडी? इट इज अ प्योरली इम्पॉसिबल थिंग। हम इसको क्योर कर सकते हैं, पर जब भी आप लाइफ स्टाइल आपकी बहुत ऐसी होगी कि आप बहुत अच्छी लाइफ स्टाइल फॉलो नहीं कर रहे हैं, आपका स्लीपिंग पैटर्न चेंज हुआ है, आप हाई कैलोरी कंज्यूम कर रहे हैं और आपने वेट गेन किया, तो पीसीओडी मैंने देखा उन पेशेंट को वापस रिपीट होता है। इवन इट इज अ जेनेटिकल कॉज ऑल्सो। मैं देखती हूँ जीन में यदि मदर को है तो डॉटर को भी आता है। खैर हम लोगों की जनरेशन में तो उस समय इतनी एडवांस पैथोलॉजी रिपोर्ट और रेडियोलॉजिकल वो नहीं थे, बट हाँ जेनेटिकल भी मैंने बहुत मेन कॉज देखा है। तो जो एक लिथार्जिक फीलिंग पीसीओडी में बिकॉज ऑफ हार्मोन होती है, उसमें उनको मोटिवेट करने में बहुत टाइम लगता है। बट हाँ डेफिनेटली जब वो हो जाते हैं तो काफी अच्छे से पेशेंट फॉलो करते हैं। और डॉक्टर सौम्या ने तो देखा भी है रिजल्ट कि काफी चीजें डिसॉल्व होती हैं, कंसेप्शन के सब इजी हो जाता है पेशेंट के लिए।
जी, definitely. Also a quick point on, I think it will be one of our last questions, adolescents PCOS. Many a times we see that the patient is suffering from delayed puberty, around 15 years, 16 years, and they've just had their menarche, and they are being suspected for PCOS or labeled as PCOS. So what's your take on that?
I think it's too early for them to be diagnosed as PCOS. I think see what happens is when you hit puberty and you start getting your menarche, because obviously we're right now seeing the exact opposite, that your menarche is starting at a much earlier age, but you do have patients who are getting menarche say at the age of 14, 15 or even 16. When your menarche starts, that is when your periods come, you have to understand that it takes time for, there is a axis which connects your brain, your pituitary as well as your ovaries together. It takes time to get a little, the hypothalamic pituitary ovarian axis. It takes a little bit of time to get a little bit mature. So initially, whenever you're getting periods, it's always irregular. You'll see that when a girl gets periods at the start, you'll see she gets her first period. Then maybe it may take about 3-4 months to get her second period. Then again, it may take. So especially if you're a girl who's at the age of 15, 16 and maybe gotten her first periods, and then you're immediately thinking, oh, irregular periods. Because of this, I've got PCOS. Don't jump to that conclusion. I think visit your gynecologist. It's a good thing. There's no harm in doing that. But they will also tell you that, wait, let your this hypothalamic pituitary ovarian axis, HPO axis, in
stabilize. Yes, so
see whether we need to. Yeah, sorry, Soumya, you were saying.
No. I think we lost. So yes, you're correct. So the Androgen, Access Society does establish this criteria that within 2 years of menarche, we should never label a patient as PCOS. And if in the 3rd year also the oligomenorrhea or if there is delayed
Less
menses,
periods, yes.
then so then you must, evaluate further for PCOS in the third year. But for 2 years, you should
Firstly,
leave it
exactly.
alone.
That's what, yeah. So for the first 2 years, let the girl get a little bit mature because her menarche
Correct.
has just started. You have to give the body a little bit of time to adjust, to go through that change of menarche. That's how they are going to understand. In fact,
Correct.
we do get a lot of patients who are coming to us at the age of 14, 13s, and the mothers are
Yes.
very hell-bent that my daughter's not getting her periods properly.
Yes.
There's nothing that's going to immediately change. You will have to give her 2 years. In fact, they are so hell-bent on putting their daughters on medication.
Right.
It is very surprising. In fact, this is just a message to all our viewers out there. Please do not ever start any oral contraceptive pills below the age of 16, because that can actually reduce your stunt.
Yes.
That can reduce the growth. It can stunt the growth of an adolescent. So unless you're above the age of 16 or 17,
Yes.
then only consider OC pills. Do not start OC pills on your own.
Right.
It is not safe. Your doctor needs to see you and then only advise you. Because I've had patients who have just started popping pills because they've read up on the internet. Unfortunately, right now, Dr. Google is sometimes really scary
Google
for
doctor.
all of us. Yeah.
Google Doctor, yeah.
So that is really scary.
Correct.
So
Correct.
please,
Correct. Correct. I
clear
think it's a
take-home
very, very
message
important point you made. Yes. Yes, we should
that
all
don't,
remember no over-the-counter OCPs, please,
yeah,
and
please.
no Google Doctor, because we don't refer to that.
Yeah.
Correct. What's your take, Dr. Suvarna? Do you face such patients? Young
Yeah, it's a
girls.
very common problem nowadays. Even हर तरह की टैबलेट्स और हर डिफिशिएंसी से रिलेटेड टैबलेट्स, मैंने तो कई पेशेंट को देखा है कि वो डाइट भी गूगल से सर्च करके और अपना वेट रिडक्शन करने की कोशिश करते हैं. इट्स क्रिएट अनदर एक्चुअली न्यूट्रिएंट डिफिशिएंसी. एक डॉग बहुत कॉमन प्रॉब्लम होती है. हम हमेशा कहते हैं कि पीसीओडी, यदि आप पीसीओडी के लेके कॉन्शियस नहीं होंगे, वेट रिड्यूस नहीं करेंगे, तो इट्स अफेक्ट योर ब्यूटी एक्चुअली इन फीमेल. तो पीसीओडी पेशेंट में जो एक्ने देखते हैं, सिस्टिक एक्ने एंड सीवियर हेयर लॉस, वो धीरे धीरे बिकॉज ऑफ दिस थिंग डिप्रेशन में जाने लगते हैं. तो वेट गेन है या अंडर वेट है, साथ में सिस्टिक एक्ने है. अब इस कंडीशन में क्या करते हैं पेशेंट? सबसे पहले डर्मेटोलॉजिस्ट के पास जाते हैं. जो मेन कॉज होता है, मेन रूट है कि वो एक टाइमली अपना सोनोग्राफी कराएं जिससे क्लियर हो कि किस तरह की उनको पीसीओडी है. तो लाइक मैं भी इवन आपसे क्वेश्चन करूंगी, जैसे हम 3 तरह की पीसीओडी देखते हैं, कॉम्प्लिकेटेड, फॉलिकुलर एंड हेमरेजिक. तो क्या आप इस तरह के लाइक हेमरेजिक है, तो फिर इन कंडीशन में, खैर डॉक्टर रोहन हमें बाद में इस चीज का रिप्लाई देंगे, इवन आप भी. तो जब एक्ने और हेयर लॉस से रिलेटेड पेशेंट्स आते हैं तो काफी सारे इवन डर्मेटोलॉजिस्ट भी इन्वेस्टिगेशन कराते हैं, सोनोग्राफी कराते हैं. पर बस पेशेंट ये नहीं समझता कि हमारा जो मेन कॉज है, मेन रूट है, वो हमारा पीसीओडी और वेट गेन है. जब हम इसको डिसॉल्व करेंगे तो ऑटोमेटिकली हमारे सिस्टिक एक्ने भी ठीक होंगे, हेयर फॉल भी. हेयर फॉल के साथ और यदि पीसीओडी है तो एंड्रोजन एलोपेशिया इज अ वेरी कॉमन थिंग नाउडेज. इवन यंग गर्ल्स में भी देखा जाता है कि एंड्रोजन एलोपेशिया में यदि पीसीओडी वेट लॉस टाइम पे नहीं होता है तो जो हेयर रीग्रोथ होती है वो भी अफेक्ट होती है. टाइमली इस चीज का ट्रीटमेंट किया जाए तो रीग्रोथ हम पेशेंट को बहुत अच्छे से दे सकते हैं विद सम सप्लीमेंट्स. और नेचुरली पीसीओडी डिसॉल्व होगा तो एंड्रोजन भी कंट्रोल होगा, डिक्रीज होगा, तो वो भी हेयर ग्रोथ में काफी इफेक्टिव रोल प्ले करता है. तो ये एक बहुत कॉमन प्रॉब्लम देखी जाती है कि पेशेंट, मतलब हर एक के बीच में, फीमेल स्पेशली यंग एज की फीमेल, इवन मैंने मेनोपॉज से पहले भी कई 40 से 45 बिटवीन भी पीसीओडी के सिम्टम्स देखे और सोनोग्राफी रिपोर्ट्स में भी, कि एवरी फीमेल को आफ्टर 30 ईयर वंस इन अ ईयर या एवरी 6 मंथ पे एक सोनोग्राफी, कुछ ब्लड इन्वेस्टिगेशन जो हार्मोन से रिलेटेड होते हैं, स्पेशली सीरम, प्रोलैक्टिन, थायराइड, ये सब इन्वेस्टिगेट कराना चाहिए. बीएमआई आजकल अकॉर्डिंग टू न्यू मेडिकल गाइडलाइन बहुत ऑथेंटिक नहीं माना जाता, पर एक रेशियो होता है कि आपके हाइट के अकॉर्डिंग इतना वेट हमेशा होना चाहिए, उसको मेंटेन करने की कोशिश करना चाहिए. तो ये जो दूसरे आप डर्मेटोलॉजिकली तो नहीं कहूंगे, बिकॉज ऑफ पीसीओडी आप फेस कर रहे हैं इश्यूज, वो भी आप टाइमली डिसॉल्व कर सकते हैं.
Yeah.
Correct. Thank you, Dr. Suvarna. I think it's very, very important. The point you have also raised. Yes, Rohan, you want to say something? Please go
Yeah,
ahead.
so I was just talking, as Madam was talking about the different types of PCO. So your
Yeah.
PCO said at the start is going to be based on three diagnostic criteria. One is your PCO morphology, which you can
Right.
see only on
Right.
sonography. One is your excessive hair
Hmm.
growth or known as hyperandrogenism.
Hmm.
And then there
Right. Right.
anovulation or oligomenorrhea where there's irregular periods. So now there are four types where we look at the phenotypes. So there is phenotype A, which is
Yes.
basically PCO on your sonography. You have
Hmm.
hyperandrogenism and anovulation. Basically, you have all three types. Then there is a category B where there is hyperandrogenism and anovulation. Basically, that is
Hmm.
here there is no PCO morphology on sonography. On C, you have the morphology
Yes.
and the excessive hair growth, and D is just your morphology and your anovulation. What we saw, basically, there's been
Correct.
research done on this. When you just have PCO and irregular periods, that means just the morphology and irregular periods are
Hmm.
seen, the chance of you
Hmm.
getting pregnant are the highest. And when you look at basically category
Okay.
C, where you have PCO and high androgen levels, your chances of conception are the lowest. So
Hmm.
these two are the most extreme things,
Okay.
and this is where we look at the different types of PCO. Per se, I'm not
Hmm.
very this about the follicular or hemorrhagic per se. We generally
Yeah.
divide it into lean and obese,
Yes.
and
Yes.
we also, and as an infertility specialist, I further divide it into these four phenotypes because that actually decides my treatment for the patient
Yeah.
who's trying to conceive.
Specific patient.
So for specific
Right.
patients, because the other two categories also have their risks, where
Right.
basically when we're looking at phenotype B, which is I think, yeah, which is basically excessive hair growth as well as irregular periods, they tend to
Right.
ovulate the least. So for me, in those patients, to try and grow the
Okay.
eggs becomes the most difficult.
Hmm.
So these are the patients which are actually a challenge to help get
Hmm.
pregnant, and they may require
Hmm.
higher treatment modalities in them. So these are small things which we have to take
Hmm.
into consideration when we're.
Right. So, Dr. Rohan, just last quick question, and we're going to end this talk because we have an
Yeah.
infertility panelist with us. Rohan, just answer that if we leave a patient with PCOS untreated, okay, and the PCOS is not getting cured, so will that long-standing PCOS lead to infertility? Can you get my question? I think he's breaking, right?
I did.
Can you
No,
hear?
I did get your. Yeah, I can hear you. I can hear you. Yeah, so
Okay,
that's not a
okay,
problem. So
okay.
now this is a double-edged sword. A patient with long-standing PCO can also get pregnant, but a long patient with
Hmm.
long-standing PCO may suffer from infertility as well. I have seen
Right.
patients who have, like as Swarna ma'am said, kgs does not this does not have any issues and
Correct.
just may get pregnant, and you'll have a patient who's normal weight with a PCO and may suffer from infertility. So there's no
Right.
pinpoint answer to this to say that a patient with long-standing PCO is fertile or infertile. But what I would suggest is that if you are considering conception, you
Hmm.
do this. If you're below the age of 30, rather 32, I would say, try for a year naturally. In case you don't
Hmm.
conceive in a year naturally, go to an infertility specialist, get yourself as well as your partner tested, find out if
Right.
there's any real cause for the infertility. If there is PCO, get that treated simultaneously while you try naturally.
Hmm.
If you're above the age of
Correct.
32, please go and visit your doctor within 6 months. I know your
Hmm.
doctor Google is going to say the age of 35, but
Hmm.
understand that 35 is as per international standards. The biological
Yes.
age of the ovaries in Indian women tends to drop a lot faster than our Western counterparts. So, as per the
Correct.
Indian standards, we always prefer a slightly younger age So I always take 32 as the cutoff.
Right.
So if you're less than 32, take a year to try and conceive naturally. If you don't meet a fertility specialist, if you're above the age of 32, 6 months try, visit a fertility specialist, get yourself tested. If everything's normal, we're not going to ask you to go in for an IUI or an IVF. We're still going to try and help you conceive naturally. But if there is any problem, we can treat it simultaneously while you try naturally itself.
Right. So to end this talk, I would like to say that the role of a gynecologist, a nutritionist, and a radiologist together plays a very, very important part in treating your and curing your PCOS and getting you pregnant also if you are suffering from PCOS. So it's a teamwork, and don't go back to Google and search a lot, because every case scenario is different. Every patient's BMI is different, like ma'am said. Every patient's diet should be different according to their height and weight, and hormonal profile, like Dr. Rohan said, is different in every case. There are different types of PCOS. So let your doctor decide, at which category you're falling, which type of PCOS you're having, whether you're having PCOS or there's any other problem also, if you are considering fertility. So there are many, many factors. It's just not one point, all right, I'll take this diet, I'll get cured, or I'll take this medication, I'll get cured. No. PCOS is a syndrome. It is multifactorial. So we have to consider many, many points. So I think Dr. Rohan, Dr. Suvarna, thank you so much for giving us such an insightful talk. And I'm sure our viewers will benefit out of this. And many of you have, got your doubts cleared. So we're still open to all your questions. You can DM us, and I will be happy to revert back to you. So in the end, Dr. Rohan, would you like to just make a point, Dr. Suvarna, just last point, a take-home message?
Yeah.
Thank you so much, doctor, for this awareness and for this great opportunity, actually.
Thank you so much, Soumya. What I would like to just say last is, in addition to everything that Soumya said, lifestyle modification is the most important factor for PCOS. That, as you say, is going to cure the disease. But if not cure, it's actually going to bring it under control and regularize your hormones, regularize your periods, and going to prevent you from the long-term effects of PCOD as well. So please take care and make sure you're leading a healthy lifestyle, especially if you're suffering from PCO.
Correct. So thank you so much. Thank you so much, Dr. Suvarna. Thank you, Dr. Rohan, for sparing your time on a Sunday afternoon. And thank you so much, viewers, for joining us. And I'm sure we're going to be back again next month with another health awareness talk. So thank you again. Thank you,
Thanks,
guys.
Soumya.
Thank you, Dr. Rohan.
Thank you, Dr. Soumya.
Bye-bye.
Thank you, Dr. Suvarna. It was really nice meeting you as well. Take care.
Thank you,
Bye,
Doctor. Same to you. Thanks.
Bye-bye. Bye-bye.
Bye.